Welcome back to the Pulse here on Joy News. You're also available on all our social media platforms. Now, let me take you to Parliament because we are all preparing ourselves for the 2024 budget statement. And as part of preparations towards the 2024 budget, NGO Send Ghana says it has been engaging Ghanaians on what they desperately want government to set up: a health emergency fund to tackle unforeseen disease outbreaks such as COVID-19, which ended up disrupting the economic gains and drove the country into crisis. Data analyst Kofi Ajay will be joining me in studio on these figures that we have it. But we'll do other things, plus take you to Parliament to hear from Koko Asante. But Dr. Deborah, with the Economics Department at the University of Ghana, will also join us soon, and then we'll look at what Ghanaians actually want to see in the 2024 budget. So Dr. Harriet Agyemang, I beg your pardon, is joining me via Zoom as we look at what Ghanaians want to see in the 2024 budget. Dr. Agyemang, you're welcome to the Pulse here on Joy News.
Thank you very much. But let me please correct the impression. I'm not a doctor.
Sorry about that.
Please, it's just Harriet. That's
right.
fine.
So Madam Harriet, I mean, we are all looking forward to what the finance minister will tell us on the 15th of November. You have been engaging other people. They have their own expectation of what the budget should look like. What sense did you get from them?
Well, we had several, because we had looked at issues of health, social protection, agriculture, water and sanitation, usually cutting across these five sectors. Our emphasis is more on health because of the experience we have all gone through with COVID-19 and the aftermath. And that is why we have called for the government to stay commitment to its own intentions to establish a public health emergency fund to cater for unforeseen outbreaks, health outbreaks in our country.
But I want to find out how crucial is this fund?
Well, outbreaks do not have timelines. It will happen when it will happen, and nobody knows when it will. And so it is important that we prepare as a country and be able to respond appropriately if it should happen. And that is why the fund is crucial, because when COVID-19 broke out, we had to go into our contingency fund as a country. And because it was inadequate, government had to look elsewhere, go to the World Bank and others to get funds for it. We want to think that those funding may not be for free, even if they are grants. The people of Ghana will definitely pay. And so if we do not want to continue to incur debts, even though it is inevitable, we as a people should look from within our country, mobilize our own resources, plan, prepare adequately. Some people have asked, why should we save money and wait for something that we do not know when it will happen? Preparing doesn't mean that the money should be lying in the bank. It means that you have to train our health workers, to be abreast with current or modern times diseases. We will have to establish the laboratories to the international standards that we require, fund the research institutions to fund. Noguchi depends largely on external funding to go into its research. I believe that as a people, we should be doing that ourselves. Internal support should be minimal, And so if we have our own fund, we'll be able to do that preventive measure. So some of the funds should go into immunization of different diseases that are coming up if the vaccines are found. And then if it should happen, then we also have some resources to respond. We had flooding in the Volta region recently. We could have had a health implication, and such a fund could have gone into support if there was an outbreak, with
in
the
the country.
flooding. So
But I know for sure that you have been following the discussion on the economy and the fact that we may not have space to accommodate all the many things that we want to do as a country because we are clearly under an IMF program. And so government's approach towards 2024 is to continually generate revenue to meet expenditure. Whilst there's been called by others for government to cut down on expenditure, generating internally generated funds is crucial, more especially when we are not getting so much support from the outside world. Do you think that government can still find a space within the limited space to accommodate the proposal that you are putting forth?
Well, we are not asking government to bring in another tax or levy us. We already have the COVID-19 levy. It was established for COVID-19 and probably other health issues. But even though COVID is not entirely over, the magnitude is not as much as it was 2 years ago. And so we are asking government to use the COVID-19 levy as the main source or the seed for this fund. Already people are asking government to scrap the levy, but we are saying we don't think so. Like you mentioned, our budgets are always in deficit and we need the revenue. If government should scrap the COVID-19 levy, it will be a revenue loss to the states, and it is you and I who will suffer at the long run or in the long run. And therefore, we need to keep that fund, but we have to go back. Government will have to go back to Parliament and go through the legislative process of reviewing the levy, changing the name to Health Emergency Fund or a name that will fit the purpose, so that it is not COVID-19 alone, because that will not be the only focus, so that fund can be used to address other relevant health issues in our country, especially when it comes to outbreak. So we are not looking outside, or we are not thinking of something new. This should start it, and then as we move along, we will begin to think of other sources. The most important is that when we assign it to health emergencies, we should just make sure we use the funds for the intended purpose. And be able to render accounts to the people of Ghana, those who are paying the levy. When people begin to have trust, or you build the trust of the people because you are using the fund for its intended purpose, when you come again and say that we want to increase the levy from 1 to 2, nobody will complain.
Okay, yeah. Let me just take you through the tall list of proposals that you want the finance minister or government to address. Ensure sustained financing of routine immunization programs, empower equitable distribution of immunization logistics, increase budgetary allocation and release to provide more sexual and reproductive health services, including providing and strengthening adolescent-friendly centers and family planning commodities, abolish period or menstrual tax, a very topical issue. Menstrual products such as pads should be considered as essential products, which should be tax-free. The cost of ready-to-use therapeutic foods, allocate and distribute enough funds for HIV and AIDS screening, testing, fast-track completion of Agenda 111, include dialysis treatment for chronic kidney failures. This is a tall list, and these are very important matters as well. But I know that the finance minister had a pre-budget meetings where, individuals, organizations were called upon to bring in their inputs. I don't know whether you had the opportunity to put this before the finance minister, as we look forward to the 15th of November.
Yes, we have already submitted. It's a tall list of health and education issues. And so we have submitted to the relevant ministries, and we have sent copies to the Ministry of Finance. These are issues that are already running in our country, and we are just drawing our government's attention to its importance. We should not neglect these issues because of the importance people or citizens have attached to it. For instance, when it comes to immunization, it's all about the availability of the vaccines. And so if government has an obligation of paying monies to our providers or our funders, such as Gavi, then our budget should take that into consideration and be able to pay so that we have the supplies in adequate quantity so that we don't experience the shortages that sometimes we do, because children sometimes may miss their schedules for immunization. We are just reminding our government that we shouldn't lose sight of that.
Exactly.
The pad issue is also a topical issue at the moment. I think the advocacy is loud now because of the price of one pad. And for some women, you may need 2 every month. And some are going, I think the lowest is 18 cedis for one. And so if you take girls from the age of sometimes 9 years who are already menstruating, and poor parents will have to get them 2 of these every month at these prices because of the taxes on it, then it's just appropriate that we call on our governments to do something about it.
Do you really think government? Do you really think that government is listening? I remember sometime back the speaker directed the finance minister
they do listen.
Yeah. The speaker directed the finance minister to do something about it. It's still hanging. The argument against it, though, from what I've heard, is that if government should remove the tax on sanitary pads, there are already companies that have been established in this country under the One District, One Factory agenda, and some of these companies are producing sanitary pads for the local market. Now, the reason why there's tax on imported ones is that it will protect those industries, because if you should remove the taxes, the likelihood of them collapsing will be higher, because then you have people go to places like China and other countries to bring in finished products. And so you would have destroyed your industrialization agenda, which is employing thousands of people, to just satisfy few people who may just go in and bring in the finished product. Is there a middle ground in between these arguments?
The question will be how cheap is the one produced internally in Ghana? If those ones, the prices of those ones are lower than what is coming in from elsewhere, I believe that we will all turn our attention to what we have in our country. But go to the market, they may all be same price, selling at the same price, and that is what makes it difficult for young girls to be able to have pads. This is health issue. You cannot reuse pads. In recent times, people are producing reusable ones, and we will advise girls to go for it, parents to go for it for their daughters. But once majority of them are not reusable, we only think that it is fair for the prices to come down, because it is part of you as a woman, as a girl. You don't call for it. It will come when the time comes. So we need to do something about it.
But did you get commitment from the finance ministry people? Did you get that commitment that they may consider it?
You may not get commitments now. It may or may not be responded to, but it doesn't mean that it is off government's radar. Sometimes they are not able to respond to it immediately, but they will keep it and look into it in subsequent budget. Remember, this budget is for 1 year. And so we have a tall list of things. They may be able to respond to some, those that can find space within the limitations we have as a budget, and some may be carried over into 2025. In fact, last year, when we went for the forum on 2023's budget, at least the Ministry of Finance gave us a list of inputs we've submitted, those that they have implemented, those that they were going to incorporate into the 2023 budget and those that were going to carry forward into 2024. So it might be a tall list, but it doesn't leave their list. They keep it and then they respond to it, let me say, bits and pieces. We think that government will be able to do all these if we are also, as a people, paying or contributing our quota in the form of revenues, so that nobody should be skipping taxes.
Let's talk briefly
and also
about
for our government to sorry, let me complete this. And
yes.
Also for our government, for the people of Ghana to see our government to be putting our resources to good.
So I was asking,
then
yes.
it feels that if they pay more, it is going to be used.
Sure. So I just wanted to talk briefly about HIV and AIDS because, as you may be aware, Ghana attaining the lower middle class meant that we're not going to receive the needed support from the Global Fund. Now, the Director General of the Ghana AIDS Commission has been out on several occasions talking about the impact that is having on education, on provision of antiretroviral drugs, and all that. Should there be a special mention in terms of government resourcing the AIDS Commission, the absence of the Global Fund, money for the sector?
Yes, definitely, because the commission is doing two things. One is putting out the messages for preventive, is to take care of those who are already infected. So they need the resources to do it. They need the resources to continually remind the people of Ghana, to live lifestyles that prevents them from acquiring the disease by protecting ourselves. And then for those who have it, they must have the antiretroviral drugs, because otherwise, if they are unable to suppress their viral loads, then they may go ahead and also continue to infect people, because they may be sexually active. And once they remain sexually active, they must suppress their viral load. And they can only do so if they stay on their medication, which is the antiretroviral. And so it is for the good of the people of Ghana, you and I inclusive, for the government to protect us, to protect the one who has it so they can live longer and contribute their quota to
development of the country,
national development, and not have it from having it. So we do not have an option as a people. If we want to throw our hands in the air, it will come back to hit us hard. And in fact, I believe that research has shown that monies we put into curative measures are far much more than those that go into preventive. So we should work hard to rather prevent reinfection and new infections, rather than wait for them to happen, and then we are looking for resources to provide medication. It will put a lot of burden on our health system.
Before I let you go, I know that the IMF and of course government, because we are on an IMF program, the IMF itself has made it clear that government should look at the LEAP program because it's very important, so that the programs that they are rolling out does not affect them negatively. Government says that there's been an increase in the beneficiaries, even though the Auditor General report says that a lot more of the money went into wrong hands. People who have died, yet we have beneficiaries taking money on behalf of them. Those who are the downtrodden, as people continue to grapple with economic challenges, what definite statement we want to hear in terms of, alleviating the harsh economic conditions of people at the very bottom? As I'll let you go.
Sure. So we will commend government for eating the leap and continually increasing the number. I think in last year's budget, the minister announced an increment in the amount that is given per an individual or per two people or per family, and that is good. It's in the right direction. What the message we want to give to government is that we need to factor in inflation. When we give these monies, we should consider the inflationary trends in our country so that the little we give to the very poor in our country remains relevant. If we are unable to factor in the effect of inflation on the little that we give them, then we might as well not be doing anything at all, because it will mean nothing. It can buy nothing. They wouldn't have any purchasing power, even though we would think that we had supported them. But that is what is important now. Whatever monies we are giving to them, we should factor in inflation. We should consider the inflationary trends, how it is going to impact on it, and give them something real. So let's give them real values of money, money that can buy, and not just because we have to give them money. Yes.
All right, thank you very much, Madam Harriet Agyemang, Senior Programs Officer with Send Ghana, and they have a tall list of proposals before government to consider. And we are talking about the